Have you ever strained a muscle, but you're not really sure what to do when you feel that pull or that stab just come up out of nowhere? Well, that's what I'm here to educate you on today. My name's Dr. Ashley, and we're here today to talk about muscle strains or pulled muscles. Common knowledge tells us to sit down and do nothing when we feel that muscle pull come up. Every step you take is uncomfortable. Anytime you contract or stretch that muscle, you feel pain. We've always been told to do 4 things: rest, ice, compress, and elevate. However, current knowledge is telling us a little bit different, and how to deal with muscle strains is changing on a daily basis. So what really is a pulled muscle? So basically, a muscle pull happens when you physically overexert a muscle, when you overstretch a muscle, when you try to ask a muscle to do too much and you try to load it a little bit too hard for the actual capacity that your muscle has. That means if you have not been training, if you have not been sprinting, or you're just simply sprinting too much too fast, you might end up feeling that little bit of a stab in the quad, the hamstring, the adductor. If you reach too far, if you're not doing sport specific or any type of specific strength, sometimes you're more apt to get muscle pulls just in general. When dealing with muscle pulls, you're actually dealing with a little bit of a muscle tear in that actual tissue. So typically what we see is a microscopic muscle tear in the region that is injured. Now, depending on the grade, we talk about muscle strain grades, we have 3. Grade 1 is a minor strain. Minor muscle tearing, that kind of achiness, that discomfort that sits there just for a few days. We can also have grades 2 and 3 strains, right? Grade 2 is a little bit more of a severe strain. You might end up seeing some bruising associated with the injury, and you might also have a little bit more of a prolonged recovery, and it might take a little bit more time to get back to sport. Now, when we're looking at a grade 3 strain, we actually are almost looking at a full tear of that muscle. So what we're looking at is actually a lot of bruising, a lot of edema, and you might actually see differences in the muscle structure side to side. The way they look might be different. And this actually, in the long run, may require surgery. It may not, but that depends on the severity of muscle damage that is assessed. So how do you know if you actually pulled a muscle? Well, at the time of the injury, it's extremely apparent. You feel a sharp stab in a muscle, you feel this stretch of a muscle, and it might actually stop you in your tracks. As you continue to move, it might still continue to hurt, and as you rest, it probably feels better. The things that typically bother a muscle that has been pulled or strained is contraction. So any type of load to that tissue and stretching, believe it or not. One of the things that people always try to do when they first feel that little bit of injury occur is stretch. And one thing I can tell you that you shouldn't be doing, don't necessarily try to stretch it out. So when you have this occur, obviously what has always been told is rest, ice, compress, elevate, but I want to go over some things that you should be doing to really help yourself get better faster. When it comes to taking care of a muscle pull, no pain, no gain is not what you're looking for. I know that over the years you've probably heard, as I've already said it multiple times, rest, ice, compress, elevate. However, that takes an extremely passive approach to muscle healing, and that's not what we want anymore. Current day knowledge tells us that implementing movement a little bit sooner when it comes to a muscle injury or any injury is not detrimental as long as you remain within a certain pain threshold. When we look at current day standards, we're actually looking at an acronym now, peace and love. So we're actually looking at a more active approach when we look at things like protect, elevate, avoid anti-inflammatories, compress, and educate. And then we go into the love, which is load, optimize, vascularize, and exercise. Those are the things that we're actually being told now to start sooner than just sit, rest, and let your pain go completely away. I'm not going to go through the entire peace and love acronym for you and how you should approach each of those, but I am going to go over some of the most important principles that you can go through when it comes to taking care of your muscles. When it comes to dealing with a muscle pull, the first thing that you need to do after the injury is protect it. However, not protecting it for a week, not protecting it for 10 days. We're really looking for you to protect it for maybe 1 to 3 days maximum. When we say protect, that means avoiding things that hurt. Don't necessarily put too much load on that tissue. Otherwise, you're probably going to delay your healing. Believe it or not, one thing that you must do when it comes to dealing with a muscle strain is avoiding anti-inflammatories. You want to make sure that you let that inflammation process happen at the beginning of a muscle injury. The reason being is inflammation is one of the first stages of healing. Now, in order to take care of inflammation, most people think about ice. However, what studies have shown us is that ice does little for actual inflammation. If anything, it's analgesic. It helps with the pain relief. So I'm not saying that ice is a bad thing, but it's not necessary. The way that you take care of that swelling, that edema in that area that actually hurts is by compression and elevation. So what you want to look for is you can use an ACE bandage, you can use some tape, you want to wrap that area up and you want to elevate it. When it comes to muscle injuries, last but not least is loading the tissue appropriately. As I've already said, old school knowledge told us that we should really be pain-free before we get back to activity. However, the pain threshold we now look at when it comes to exercising with any type of injury or even just a muscle strain is you need to remain under a 4 out of 10 at all times. Well, between different research groups, it is actually shown that these two groups, whether you're pain-free or you're in that 4 out of 10 category, you rehab the same. And believe it or not, those who don't necessarily always wait for that pain-free category may be less susceptible to re-injury in the long run. The reason being is when we implement easy movement or early movement, when it comes to muscle strains, you actually get that tissue and the tissue properties working a little bit sooner, right? You don't necessarily always want to sit and wait around, and you want to get some activity in. You want to get back to your ADLs, so your activities of daily living, walking, stair climbing, moving as fast as you can post a muscle injury. And the reason being is that you don't want that muscle to stiffen up. You don't want it to lose capacity. Now, with me saying that, that doesn't mean get out and run. That doesn't mean get out and do a lot of plyometrics, so jumping based activities. Don't go try to sprint right off the bat. The big thing is that as you're recovering from a muscle strain, what you need to remember is that you should increase your return to activity slowly. For grades like grade 1 strains, right, it might only take you 2 to 3 weeks to get back to activity. When it comes to grade 2 strains, it could take up to 2 to 3 months to really feel yourself. And when it comes to a grade 3 strain, which typically does involve a full muscle tear, it might take a very prolonged period. You might end up with a surgery, and it can take, say, 6 to 12 months to really heal from that. Well, I'm Dr. Ashley. I hope that this information in this video was beneficial to you if you are dealing with a muscle strain. And as always, if you have any questions, don't hesitate to post them in the comments section below.